So today, what we're going to explore, we're going to look at truths and myths about menopause and how it can affect both physical and mental health. I'm going to give you a quote from Michelle Obama, and she said, "The changes, the highs and lows, and the hormonal shifts, there's power in that, but we were taught to be ashamed of it and to not even seek to understand it or explore it for our own edification." So let's explore. My name is Diane Pullyblank. I thank you so much for joining me today. Tiny bit about me. By profession, I'm an exercise physiologist. I've been in the health and wellness field for many, many years. I think it's like almost too many to count. And during that time, I was general manager of a very large multi-sport health club in Westchester County in New York. I also was an associate professor at Barnard College in Manhattan. I did a lot of continuing education training for health and wellness professionals, and now I get to present seminars and webinars and workshops on really, really great topics such as menopause and mental health. My goal today is to educate and empower you regarding menopause. In other words, to give a broad overview, and it's not intended at all to give medical advice, to diagnose, or to make treatment recommendations. If you have any questions or concerns at all, please consult with your healthcare professional. And the primary content of sort of what we're going to talk about today focuses on individuals who were assigned female at birth. But I want to acknowledge that not all people who go through menopause identify as female or identify as women, and not all who identify as women or female will go through menopause. Okay? For anyone who is transgender or non-binary, you may have different experiences and should talk with your personal healthcare provider. Okay, excuse me. Information on standards of care can be found at the World Professional Association for Transgender Health, and I'm going to put that URL into the chat box right now. Just have to type it in and hope I don't misspell. Okay. So please take advantage of that. Okay, so let's go. Let's explore. These are our learning points for today. To understand what it's all about, explore, discuss, and just be flexible. Okay, you did receive, when you registered, you did receive a workbook. I am not going to specifically refer to that, but please download it and take a look at it. And at the end, there are some really pretty insightful questions to ask yourself to gain a knowledge about how you feel and what you are going to be doing. Okay. So we're going to start with understanding menopause. Kind of a big topic there. What do you think you know? What do you think you know? What does menopause mean to you? What are the images that come to your mind? Put in the chat box. I would love to hear it. You can just put them directly to me if you want, or you can put them so everybody can see them. You know, hot flashes, of course. Oh, menopause causes depression. Yeah, of course, hot flashes. Yes, thank you. Hot flashes, mood swings, weight gain. Yes, older age. Okay. And I saw that the link to the workbook was just put in the chat box. Hormonal imbalance, anxiety, irritable. I love these. Thank you. Hot flashes, just becoming old. Loss of hair. Yes, my mom's suffering all the time. Where did these images come from? where do you think these images come from? They kind of come from maybe your older relatives. They could come from your parents, your mom especially. They could come from the media. There's all kinds of places that these come from, okay? And then also menopause begins at age 50 for all women. No, so let's take a look. Let's take a look and just see what we can do. There are so many facts as well as myths that people generally know about menopause. So today we're just going to kind of, I don't know, scratch the surface of beginning to sort facts from fiction. Okay. And there's an awful lot to learn. We're only going to go through a little bit of it. And one fact, absolute fact, beyond a doubt, is every woman experiences menopause differently. Okay, so let's take a look at some facts, common symptoms. Okay, the truth about menopause. Menopause begins in most women between the ages of 45 and 55. What I'm going to put out there is the fact that actually menopause has kind of three phases. There's perimenopause, there's menopause itself, and then there's postmenopause. All right. What we generally say, oh, I'm in menopause, is actually perimenopause, but we're going to use the term menopause today. Okay. All right. Menopause, women reach menopause when they have not had a period for 12 consecutive months. That is very true. Menopause itself is a very specific point in time. All right. And you can count it. It is 12 months from the end of your last period, 12 months to the day almost. All right. So that's how you know that you are actually in menopause. And then it's post-menopausal after that. I want everybody to keep in mind during perimenopause, we're going to talk about perimenopause in just a moment. During perimenopause, you can still become pregnant. Your ovaries are still producing eggs, and you can still become pregnant. And I have dealt with a lot of women who have had surprise pregnancies at age 45 or 50 because they didn't think they could get pregnant. Just keep in mind, until 12 months after the end of your last period, you can still get pregnant. After that, you can't. Okay. All right. Symptoms usually start, menopausal symptoms usually start months or sometimes years. It's very, very individual. Okay, some women will experience perimenopause for maybe 5 to 6 months. Others will experience it for years, and some continue perimenopause symptoms after they have reached their 12-month mark. Okay, everybody is different. Everybody is different. Okay, so hot flashes. Hot flashes are those sudden, short feelings of heat. Usually starts in the face, all right, neck, and it makes it all, the skin all red, and you sweat a lot, and it's really not very, very comfortable. And to be honest, hot flashes, everybody put it in the chat box, right? Hot flashes are the most common symptom of perimenopause. All right, but it's important to keep in mind that women experience menopause that is absolutely unique. All right, no two women have the same symptoms. I'm going to keep repeating that. And menopause is not a disease to be cured. Okay, the symptoms can certainly be treated. It's not a disease, but it's something that can be treated. Never heard about perimenopause from my mom or other women around me. Absolutely, absolutely. You know, You're in your 40s and you kind of wake up in a sweat at night, and you're you're getting irritable all the time when you go, what is going on with me? Right? You're in perimenopause. And we just don't talk about it. So let's talk. Let's talk. So, all right. Perimenopause is also called the menopausal transition. All right, that's just another word for it. Okay. It is when estrogen and progesterone levels start to decrease, your ovaries stop producing as many eggs. All right. And there are a lot of symptoms that go along with this particular time of life. Okay. So actually, I'm going to go back one slide and do this a little bit more. The term perimenopause is often used interchangeably with menopause. Like I said before, they're very different. They're very different. Menopause happens 12 months after you've had your last period. I already said that. All right. The time before that is perimenopause, and symptoms can be similar to those that we associate with menopause. So alcohol and caffeine will cause hot flashes. On some people, absolutely. I just spoke with somebody the other day who said that she's in perimenopause and she cannot eat cruciferous vegetables. Just can't eat them. Gives her heartburn. She's never had it before. Everybody is different. Everybody is different. So some symptoms are night sweats, shorter menstrual intervals. They can be very, very heavy. They're irregular. You're just not sure exactly what's going on. Okay. Sleep can be hard. Night sweats, right? And of course, hot flashes. And then the good news is, once a woman reaches menopause, like that 12 months, their hormone levels can stabilize. But during perimenopause, they're up and down and up and down and up and down, right? Boy, isn't it great being a woman? It actually is. It actually is, but we just need to grab hold of it and take ownership of it. Okay, so what causes menopause? All right. Menopause happens when a woman's ovaries stop producing as much of the hormone estrogen or progesterone, and they no longer release an egg. All right. You can start having either unusually light or unusually heavy periods, with frequency being affected, right? One may start having either, like every 2 to 3 weeks, or a space of months in between periods. It's a very difficult time to know what to do, right? And premature and early menopause can occur in women before the ages of 45. All right, it happens sometimes. If menopause occurs before the age of 40, it is generally referred to as premature menopause. All right, and this is all things that we need to discuss with our healthcare professionals. Also, there are other things that can cause your body to go into menopause. Surgery to remove the ovaries, of course, that's going to put your body into menopause. Some cancer treatments, some chemotherapies, some radiologies also can result in damage to the ovaries, which can put you into early menopause. All right. And any underlying condition like an immune issue or a genetic or some metabolic conditions, they can put you in early menopause. I'm definitely in menopause, but I still experience some hot flashes, and I'm always hot. That happens to some people. See, that's what I'm saying. Everybody is different. Some people go, oh, it just is, it's over, and I'm just fine. Everything's gone away. And other women go, I'm still experiencing all of these things. It's very, very individual. And so we can't make broad generalities at all. We kind of have to say, all right, well, let's look at this person, and let's look at this person, and let's look at me as an individual. Okay, but let's look at some of the common symptoms. common symptoms. Of course, hot flashes, right? Weight changes, very often redistribution of fat. Fat in some women will migrate from their hips to their stomachs. Okay, your periods change. Your vaginal health changes. All right, you can experience vaginal dryness. All right, changes in weight. Some women lose weight, some gain weight. You don't have to gain weight, but it is something that quite conceivably could happen. Okay, and changes in your libido. Some women have an increase, others experience a libido decrease. Bladder control. Very often there's increased frequency of urination, and you just can't get to the bathroom fast enough, right? Also UTIs. They are very common in perimenopausal women, all right? And then some women experience a decrease in body strength, all right? Okay, good question. What about a partial hysterectomy, but you still have your ovaries? Everybody's going to be different with that one. I keep saying that. I wish that there was like a total answer that I could give you. Some women will go into menopause when they have a partial hysterectomy because you still have your ovaries and they're still producing eggs. Okay, it's all individual. And it's hard to lose weight. It can be very, very hard to lose weight. And partly that's because, even just taking menopause aside, as we age, we very often become less active. All right. And that can make it hard to lose weight also. And then joint pain, decreased mobility. Oh, there's so many things, right? Your bone density can decrease at this point in time. This is probably where your healthcare professional will recommend that you go for a bone density test. Okay, your skin changes. I can't tell you how many people have said, I never had acne as a child, but I am getting it now that I'm postmenopausal, or now that I'm in perimenopause, I'm getting it. Question was, what can we do? We can't avoid it all. We just can't. We can deal with the symptoms. We can do our very, very best. And the best thing we can do for ourselves is to keep a positive attitude and to just understand that this is what is happening. Okay. I've been on menopause for about 8 years, seems to be getting better. How long does it usually last? It's all different. I wish I could say, oh yes, another year and you'll be fine. If I eat too much bread or gluten, my joints kill me. See, everybody's different. Thank you for all of these. I really, really appreciate them. All right. These are all of the not great things. All right, cognitive changes in the way that food tastes. Very often we have smell changes, right? Things don't smell right. It seems to last forever. I agree. Brain fog, absolutely. Yes, okay. And just like the senior moments are actually part of menopause also. Okay, thank you for all of these. I love it. But there's an upside. Not everything is bad. Okay, not all physical changes by reduced female hormonal levels are negative. I was confused about the brain fog. I thought I might have long COVID. You never know, Never know. So the end of periods means the end of menstrual symptoms like cramps, heavy bleeding, often headaches, all of those things. All right. You can't get pregnant. A lot of women really, really welcome that. Some women go, no, this is not what I want. But, because they equate it with getting old. Okay. Many women find after they have finished perimenopause and they are actually menopausal and postmenopausal, they have more energy, able to exercise more, just generally feel better. Okay, then a lot of the emotional and social changes can be very, very good for you. Very, very, I'd say energizing. They just make you feel good. They make you feel good. And a lot of women experience I'm going to say a renewed zest for life, and they're much more optimistic about what's going to happen, about the future, all of those things. Okay, so there's the downside, but there's also kind of the upside. It's not something to be dreaded. Okay, but let's talk about mental health. Let's talk about mental health. So, what have you heard? What have you heard about mental health? Due to brain fog, I have to tell and apologize to my boss when I make a mistake. This will keep happening because I'm not the Vicky from 20 years ago. What a great attitude. Thank you. Thank you. Yes. So what have you heard about mental health? About its impact on mental health? Brain fog, cognitive issues, not a thing. Okay. Brain functioning changes. Brain functioning changes all the time, feeling on edge at all the time, feeling irritable, kind of feeling like you're going to explode from time to time, doubting our ability. Yes. Okay. Anybody else? Anybody else? Well, let's take a look. Let's take a look. What have you read or heard about it? All right. So I love this. You're in your 40s and 50s, have a time when life's pressures can be greatest. All of the stress can add to mental health challenges. Okay? So let's look at them. The hormonal changes, depression. I'm going to talk about that. I'm going to talk about that. Depression and anxiety. Okay, the hormonal changes that are a really significant characteristic of menopause have physical and psychological impacts, such as fatigue. Because you've got sleep disturbances, right? You wake up a lot at night. You might wake up in a sweat at night and have to, change your night clothes. Okay, excuse me. More intense emotions. It's kind of like you're feeling everything doubly or triply, right? Increased stress, and then depression and anxiety are common during menopause. However, women who have experienced depression or anxiety early in life have a higher likelihood of experiencing mental health issues during menopause and during perimenopause. Okay, so if you have had previous depression issues, depression, anxiety issues, they may become intensified. All right, but all the studies have shown that 16% of women in perimenopause and menopause are suffering depression for the first time. Now, I also have been reading studies that have shown that in some women who have suffered from diagnosed depression, a diagnosed mental illness of depression prior to menopause have got better during menopause. There's no two people who are absolutely alike. Okay. And also while experiencing perimenopause, women are also going through a lot of other changes in their life, right? Which just kind of can exacerbate all of this stuff. A lot of it is role transitions, right? Role transitions, like from being a parent, your kids get up and out of the house at this time, right? And then you may become a caregiver for your parents, all right? There are also an awful lot of psychological changes, and there was a study that was done, a comparison study that was done by Australia Psychiatry, and they said They said menopause, I'm going to quote this, menopause increases vulnerability to depression and anxiety, perhaps via estrogen fluctuations affecting serotonin and GABA. Could be. Okay, fair enough. It was hard for me to be sure where the depression and anxiety came from. It was happening during the pandemic. That has happened to us too. All right. But what this means is menopause can lead to depression and anxiety in some women, but not in all. I feel like I keep repeating it, but not in all. Okay. So let's look at depression. Depression is actually a diagnosed mental illness. Okay. It's a mood disorder that causes a persistent feeling of sadness and loss of interest. I'm just going to read this. It affects how a person feels, thinks, and behaves, and can lead to a variety of emotional and physical problems. All right. It is sometimes called major depression. If you feel that you are suffering from undue depression or anxiety, please seek some help. Please seek some help. So let's just talk about it for a moment. It's diagnosed often after a person has had symptoms for 2 weeks or more. Okay, we all feel sad and blue from time to time, right? I mean, we do. That's just kind of, the emotional cost of being a human being. We're not happy. It's not rainbows and unicorns all the time, right? We do feel sad and blue from time to time, but if it is something that is affecting your life and it has lasted for 2 weeks or more, please get help. Get some help. It's got a lot of different signs and symptoms that are going to affect people in different ways. Being really anxious, that feeling of emptiness, and it very often you feel it in your stomach, okay? You just can't get yourself going. Changes in appetite, either eating more or eating less. All right, and then your weight was going to probably follow that. You either can't sleep or you can't get up. You're oversleeping. Feelings of worthlessness, feeling guilty about all kinds of things, and just plain trouble thinking or concentrating. You can't make decisions. That can also be a symptom of depression, and frequent or recurring thoughts of death or suicide. Okay. If you have any of these symptoms and they have lasted for 2 weeks or longer, please consult with your healthcare professional. They may say, no, this is not really depression. It's just whatever else it is. But it's better to err on the side of caution, right? And all of the things that we just talked about, don't diagnose depression. Diagnosing needs to be done by a qualified healthcare professional. Okay, and it's important to keep in mind the changes you observe may not be related to depression or other mental health conditions. For example, if you're feeling tired all the time and you're just not, you're feeling exhausted, it could be the result of a lot of things that are not related at all to mental health. Okay, so please, A, don't jump to conclusions, and B, see your healthcare professional. Just put the TELUS Health EAP line, a dedicated phone line. Please use that, all right? And then overall, when someone is mentally well, it's ups and downs. There's good days, there's bad days. Generally the good days outweigh the bad, right? And it's normal, and the downs are temporary, right? On the other hand, when someone is in a state of anxiety or depression, it can feel like it's here forever. It's permanent, all right? And they can wonder if they will ever get back to being that wonderful person that they were before. Okay. So let's just move on from depression. Now, this is my question to you. How is it viewed? How is menopause viewed in this country, in your culture? How is menopause viewed? It's not talked about. Okay, it is ignored. It's not talked about. Like, women are absolutely crazed when they're going through it. In my Asian culture, thank you. Yes, in my Asian culture, or at least in my family, it's not a thing. It can be very, very cultural. We in North America tend to put a stigma on it. All right. It's another weakness of women, right? People don't understand it. It's ignored. What else? What else? The fact that there is not more research on it tells you that how this country views it. Very true. There is much more research going on right now. Been great strides made in Great Britain. It's been, if you want a really, really good resource, I'm going to put one in the chat box later. Okay, Great Britain has done tremendous strides in menopause. People don't talk about it. They think, people think your sex life change. It's TMI to talk about it. People don't, they say that you're going crazy, and that's very true. Okay, but it was interesting in my Asian culture, it's not a thing. In cultures where women are really well regarded, I'm Salvatorian and I've never heard it mentioned in my family. Okay. Culture can influence even the biological symptoms. All right. In societies where menopause is just considered to be what happens, it happens. It's part of life, right? Women experience fewer of the perimenopausal symptoms. Okay. So what influences your symptoms? Your lifestyle. And that can be a result of your culture, right? Smoking, diet, exercise, even your reproductive history. It's hard at work because there is not necessarily acknowledgement of the symptoms, and we're expected to function as normal. It's a psychological nightmare. Okay. All right. We're going to talk about how managers might be able to help. Okay. Then also your socioeconomic status. All right. Where do you live? Where's your community? This all affects how people respond to and react to menopause. All right. And anecdotes have shown that in cultures that put a priority on multi-generational family environments, all right, menopause is less of a deal because people learn of experience. They learn from experience by watching it happen within their multi-generational family. The Native Americans tend to regard it as it's what happens. Many of us are reaching birth milestones. That's very true. And that is at this time, right? Generally, between the ages of about 48 and about 50, well, even 60, all right, work milestones. And this affects us then. Okay, all right. Symptoms data across cultures varies greatly due to the ways that participants are asked about their experiences. Also, it's important to keep in mind how language and context matter. No grace given for what is happening. Expectation of family and work have not changed. Very true. So let's talk about menopause in the workplace. Great segue into that. Thank you. All right. I'm going to give you a few statistics. By the year 2030, 30% of the workplace is going to be experiencing menopause. By the year 2030, that's not very far. All right, so let's talk about this. Female population is approximately 4 billion worldwide. Okay. Well, many of us are working later into life, right? We don't stop work at, used to be age 65, you stop your work, right? Many of us are continuing for a long, long time. Okay. And you're working while you're experiencing perimenopause, and you're going through menopause, and then even through postmenopause, right? It makes it vital to understand about menopause and speak openly about it, which is hard, which is very, very difficult. There's been a lot of workplace studies that look at attitudes to menopause. Okay, not enough. And as I said, a lot have happened in Britain, not so much here. And there's research on pregnancy, but there's not the research on what happens after we start to age. Okay, so very often what happens, we feel othered, right? Oh, just ignore her, or, you just don't feel like you're part of it anymore. Okay. And that can make us feel bad. That can make us, sad. Exactly. Exactly. And, and actually can exacerbate menopausal symptoms like anxiety and loss of confidence. Not going to work because of menopausal symptoms. Some people can do that. Some people can do that, work from home because of menopausal symptoms. I bring a fan with me and work goes on. Yes, absolutely. Different things work for different people. Another thing is to make sure when you're going through perimenopause that you keep a nice container or a jug or a water bottle of ice water. And as soon as you feel a hot flash coming on, have some ice water. It will help to cool you down. Okay, dress in layers. That's another thing that you can do. Okay, you don't. I tell you, I managed a team of 12 managers, and I had one of them who was going through menopause, and she would come into team meetings going, just let me cool down, and then I'll come and sit down. She brought it in with humor, and everybody understood exactly what was going on, and nobody was embarrassed. Okay, but the problem is workplaces very often marginalize our bodies, women's bodies, right? And they find that and most of us really aren't prepared for this, right? We're just not prepared for this. So it's hard to speak to our managers very often about it. Have any of you spoken to your manager about it and said, look, this is what's happening. This is what I'm going through. Okay, yes. And what happened? I'm getting no's. Yes, it was uncomfortable, especially if your manager is male. Okay, I'm embarrassed. Haven't spoken to them. Okay, it is, sometimes it's really important to get these things out on the table. All right, even if it's embarrassing for you. I know of companies that have started chat lines for menopausal women so that they can talk to each other. Okay, others have dedicated cafe space where it's cooler. It's got lots and lots of drinks, cool drinks that are available. And I love this. My entire office is going through it right now, so it's feeling good, right? There are many, many things that we can do. We actually can in the workplace take a lot of very positive steps. Okay, and the chat line has absolutely. I think they use Snapchat maybe. Absolutely been a lifesaver for a lot of people. Okay, our male supervisor just takes it in stride. Great, very good. And so men tend to get very embarrassed by it because it's not something that happens to them. Okay, but the more that you can bring it out into the open, the more that you can talk about it. Bring a fan, keep water on your desk, keep really cold ice water on your desk. dress in layers. These are all things that will really, really help, and it will help to bring it more into the norm, okay? Some women leave their jobs. Some women leave their jobs, okay, which is terrible because we are really valuable. You know, we have tremendous talents, we have tremendous experience, but if we don't feel accepted, if we feel marginalized, if we feel othered, okay, that makes it very, very hard to go into work, okay? All right, I think I'm depressed, apathetic, don't want to do anything. My suggestion is please go see your healthcare professional or call the number that was the TELUS number, please, because you don't want to go through that. You don't want to go through that, okay? All right, so let's talk about how to make a workplace conversation. I'm going to read this. Managers should try to understand as much as possible about the different ways in which women can be affected by menopause, but also understand that it's not always a problem and most women get through without particular difficulties. Okay, this is part of what's happening in Britain right now. That's from King's College. Okay, thank you for reposting the TELUS Health EAP number. We encourage each other, share stories. The more you can share stories, especially if you can share stories with your younger female coworkers, that is going to help to normalize it for them when they come up to this stage. Okay, but managers can have a lot of influence. Okay, because workplace culture and open conversations can just lead to really, really great changes in the workplace. Okay, I'm not saying it's going to happen overnight. It's not, but I do think that it is important to start these conversations. And the managers, especially female managers, now all managers should have training in how to deal with life changes with their staff, okay, with their reports. That doesn't always happen. I'm hoping that it happens for you, okay, because managers then get to set the culture, get to set the tone with their teams. It's not easy, especially if the manager has gone, oh, yeah, I don't want to talk about any sensitive topics here. No. Or if the team does not have a culture of openness. Talking about menopause can be really, really hard, and it can make a lot of team members feel vulnerable and just feel unsafe. So it's important to get everybody together on this particular topic. We're going through issues with aging parents too. Yes. Yeah, you have to. Managers, being a manager is difficult, but you do have to be sensitive to all of these life changes that happen. Okay. All right. Now, an effective manager knows that before these conversations can actually get going, the team culture has to be one of openness. They need to encourage a team culture of openness, of non-judgmentalness, and trust. And trust, because you're not going to talk if you don't feel that you can trust the people that you're speaking with, right? Okay, and the other thing is, okay, so what happens sometimes, and I've seen this, it's very interesting because you get training for managers on how to manage sensitive situations, okay, and a lot of the training involves big words, right? Euphemisms, really super technical language, right? So for menopause, think of what you're saying. Especially if you're a manager, think of the words that are coming out of your mouth. And ladies' problems. Oh, well, let's discuss the ladies' problems. No. Or age-related, gender-specific problems. Okay. You want to just talk in normal language. when people start using really long words, I always say, can you use small words that I understand? Okay. And then the King's College in London has done a lot of research in this, and they have come up with some tremendous resources and findings. Okay, but they said that women said that one of the most helpful things a manager can do is to simply demonstrate and talk about their knowledge of menopause, especially female members, managers rather, especially female managers. But men have experience with menopause also, either through their mothers, through their female relatives, through their spouses. All right, they do have experience and they can help. They can really, really help. Okay, and it's making it not a problem. This is a problem that we have to overcome. No. So just don't make assumptions based on prejudices or generalizations or on the experiences of other individuals. Okay, you have to have really open conversations. And you know what? Leadership through managers and above is so, so important. So here are some steps that managers can take. And you know what? Each one of us can take these steps too, all right, to open up the conversation. Training, just like this, raise awareness. Training, it's very, very important, okay? Just common sense things, like if you know that someone is going through menopause and experiencing hot flashes, can they sit by an open window? Can they sit close to a bathroom because they might need to get up and go to the bathroom very frequently? Are there just those kinds of physical accommodations that you can make? Okay. Cold drinking water. Just plain cold drinking water. Okay. And desk fans. You can always bring in your own. Maybe your company can provide them. Okay. If possible. And some companies have done this. I've seen this done. I was dealing with a law firm, and this is what they did was, they were very progressive, and they actually had lockers that were designated for perimenopausal women, where they could keep a change of clothing because very often you sweat through your clothes. Okay. Don't forget, when you're planning your meeting agendas, breaks. If it's going to be a 2-hour meeting, you may need bathroom breaks. You may need cold water breaks. Plan the breaks in, okay? And one of the absolute best things that a manager can do? So how are you? How are you feeling today? How are you doing today? Just kindness, plain kindness. Can I do something that will make your work condition better? Is there something I can do to make your work less challenging? Brain fog. Brain fog happens. You get over it, but it does happen. Okay. If possible, flexible working hours are always a really, really good idea, because if you're not getting a really, really good night's sleep, you may be getting up later in the morning. Okay. And you may need extra time there. And just, ask them, what can I do? What would you, now I'm asking you, what would you like to see happen? What would you like to see happen to help with the people that you work with, your coworkers? What could your manager do for you? What would be very helpful to you during this time? So as you put that in the chat box, I'm going to move on. So what can managers say? Thank you for letting me know. I'm confident we can work through any work concerns that you have together. In what ways can I support you? How can I support you? You go to your manager and you say, I'm doing this confidentially. Don't worry. I'm not going to say anything. All right. And you're important to the team. So I want to make sure you continue to work with us. I am here to support you. I am here to support you. I would like to look at methods that would help. How can I help? I will do some research. Would you mind? This is another really good one. I like this one. Would you mind if I checked in from time to time to see how you're feeling? Okay. Managers can be a huge help. So some actions that women can take. Listen, knowledge is power. Knowledge is power. Menopause comes with a lot of challenges. It does for everybody. I don't care who you are. It comes with challenges, even if you don't have, a 3-year or 4-year perimenopause. If it's 8 months, 6 months, it comes with challenges. Okay. The key is to take it one day at a time. All right. Keep in mind, the more knowledge you have, the more power you're going to have. So find reputable sources. Okay, you don't want to be looking at TikTok videos and seeing what young people are saying about menopause. Okay, find very, very reputable sources. Okay, and then social media sources, like I just said, can be helpful. But they're very often not very reputable. If you're going to look at YouTube videos, if you're going to do anything like that, please check the source of them first. There are some great menopausal yoga videos on YouTube. Also some exercise videos that will help with joint problems, with joint stability, that will also help with your sleep issues. Please take a look at those, but just make sure that you're checking them. Okay. All right. Exercise, extremely important. Extremely, extremely important. It reduces the metabolic risks associated with declining estrogen. All right. It reduces the risk of high blood pressure, of heart attack, of stroke. Strength training is going to help to offset the decline in muscle mass that we all experience, but we do experience more post-menopause. All right. Natural, muscle strength naturally does decline with age, but we can do things about it. Exercise has been proven, and I know you know this, to reduce stress and improve mood, and it actually can help reduce hot flashes. I have people who tell me, I don't want to exercise because I get these hot flashes and I just don't want to be hot anymore. It can actually help to reduce hot flashes. Okay. Walking for exercise eliminated my hot flashes. Thank you for that in there. Brisk walking is great. It's great. Getting outside is great. It's great for your mental health as well. Okay. Anything that you do that is not just sitting or lying down is going to be beneficial to you. So what helps? Exercise. Make sure that you're going to get your regular checkups. Okay. Make sure that you have a good social network that you can talk to. Talking helps so much. Don't forget to laugh every single day. Don't forget to dance. I suggest that every morning before you turn on your computer or before you walk out your door, you take 5 minutes, put on really, really great music, however loud your living environment will allow, and dance. Dance for 5 minutes. It will make you feel so good, and it will help with your menopausal symptoms. I promise that. I promise that. Don't forget, tell people what you need. We all have needs, but we very often don't express them. We don't tell them, so people don't know what they are. And we also have boundaries. If people don't know what our boundaries are, especially about things like menopause, we can have boundaries about menopause. If people don't know what they are, they don't know when they've overstepped them. So you have to communicate. Okay, so I feel like I was just on a soapbox there. I am here for your employee assistance program, UnitedHealthcare. And if you have not taken a look at them, the phone number was put in the chat box several times. So please, if you need it, it's professional support. Do not ever hesitate to reach out for professional support. We all need it from time to time. Okay. All right. So questions. If you have any questions, I would love to have them. This is a quick little survey, and I am going to, before you go, I am going to put in another URL. There is a very great website called Tina, T-E-N-A. If you just take a look at it, it's British and it is hysterical. There are wonderful, wonderful quotes from women on there. Okay. All right. So I want to thank you. And if you have any questions, please put them in the chat box. I really hope that everybody has a wonderful day. It's spring. Get out there. Use this time to get out and get some fresh air. Thanks, everybody. Have a great rest of your day.